Okay, cool. So keep writing into the chat box for folks that are joining and introduce yourself. I'll just say for everybody that has not joined us for a community conversation before, I'm Ashley. I'm the founder of Birthsmarter. I'm a birth doula and a postpartum doula, a lactation counselor, and a childbirth educator. I am from New York and recently relocated to Salt Lake City, Utah, though I'm not currently there. And the community conversation series started as a way for me and the Birthsmarter team to connect to professionals to have the conversations that we wanted to have to really improve the quality of our teaching, and connect the dots between all of the subjects that don't get enough attention. So as an individual who teaches lactation classes and runs new parent support groups, tongue ties are something that questions about tongue tie come up a lot, and I don't have the answers to them, nor do I really have people that I trust to refer to. And then got this recommendation for Dr. Tara in Nevada, and I'm just really thrilled that she joined us. So I will just say super quickly for folks that don't know Birthsmarter, we're a community for growing parents online, and we offer a lot of different classes for people in pregnancy and who are in the first few months of parenting. I run pregnancy and postpartum support groups, and we've got a bunch of curated resources. We also host these conversations almost every week, which are all free. We just launched an on-demand class, and all of our classes are pay what you can. So if you have pregnant clients that are struggling financially, you can still send them to us, and it's a no questions asked policy. So that's me on Birthsmarter. And for the rest of the day, the idea is, or the rest of the hour, the idea is that Dr. Tara is going to give us a little presentation, and then we're really going to open it up to a Q&A and conversation so we can learn from and with each other. Okay, Dr. Tara, do a little bit of another brief intro for the folks that came in late, and then we'll jump in.
Okay, so my name is Tara Erson. I graduated from dental school about 12 years ago. I expected to be a kid's dentist and fix teeth, but about 5 years ago, I started learning more about tongue tie, and the more I learned about it, the more I realized that it was really something that needed to be, that people needed to have access to, and that wasn't available here in Las Vegas. As I learned more and more, over the first 3 or 4 years, I was at a conference a month. I've tried to take every single tongue tie class and hear from every expert, to really get a well-rounded idea of what tongue ties are. And so about 2.5, 3 years ago, I stopped doing teeth and started focusing on tongues. And so now my practice, do a lot of infant frenectomies, but I also do early intervention expansion, airway, sleep, breathing, those types of issues in my practice too.
That's amazing. I'm stuck in the comments and seeing questions that are already coming in. So I think let's just do like a brief let's start with definitions and make sure everybody is on the same page. So what are we talking about when we're talking about a tongue tie versus a lip tie? When do those things get diagnosed? Who diagnoses them? Like, can you give us an overview of the field?
So in simple terms, a tongue tie is simply when the piece of tissue underneath your tongue is tight enough that it is restricting the way a tongue should move. And unfortunately, it's more of an art than a science, because there are about 100 different versions of what tongue ties look like. And so it doesn't help. I mean, we could spend all day talking about, what tongue ties look like. There really isn't one way. But if your tongue is not capable of doing proper function, then because of a restriction, then that's a tongue tie. A lip is the same concept, and it kind of depends where you are in the lifespan for lips. I do a lot of lip frenectomies on infants because being able to comfortably flange that lip on the breast helps the latch. It can decrease pain. It can make it more comfortable for the baby. But, if I get a 2-year-old where the lip is super flexible, I'm less concerned about fixing the tongue or the lip tie at that age. It's not causing a problem. So in terms of diagnosis, you really have to find someone who knows what they're talking about. I mean, that's the bottom line. The document I sent you has some links that I've compiled that are a really good place to start. If you don't have any ideas in your area, there's 4 or 5 different ideas where you can search. And I don't just mean a tongue tie provider. I mean a speech and feeding therapist, a lactation consultant, a body worker, an ENT, a pediatrician. I mean, there's lots of different types of people who can talk to you about tongue ties. It doesn't have to be a dentist or someone who can do the procedure. The thing that I think is really important for people to understand is that dentists, pediatricians, ENTs, lactation consultants, speech and feeding therapists, just because you're one of those things doesn't mean that you learned about tongue ties in your general education. In fact, you probably didn't. And so while many parents want to assume that because you're one of those things you know about tongue ties, you actually have to assume that they don't and work backwards. You essentially have to interview people, and that really puts the onus on parents, which is hard. In so many cases, we want to be able to trust our medical providers, but that relies on a medical provider saying, you know what, I'm not sure about that topic. Let me help you find someone who does know something about that topic, versus just going, oh, I've heard about that before. It's no big deal. Don't worry about it, which is happening constantly. So hopefully, you have the resources to try and find that person in your community, but also a parent needs to have just some basic knowledge to be an advocate for their family, because what matters is that a parent feels like their concerns are being addressed and not dismissed. And so sometimes that just requires finding another person to talk to.
Can you walk us through how, in your mind, like having the expertise that you have, how would a parent or a professional even who's not working go about assessing like the quality of knowledge that someone has around tongue tie? And I think I'm asking this specifically because what you brought up feels so on point for our community, that like we want to trust our medical providers, but also now everybody is fairly skeptical. And I think tongue ties in particular are a place that people are skeptical because there's both like, hey, tongue ties are a magic bullet answer to breastfeeding trouble or other trouble. And then the other extreme, which is their tongue ties are being massively overdiagnosed and they're not a real issue. And my guess is the reality is that it's somewhere in the middle, right?
Sure. I think probably the easiest way to vet people, or the most surefire way to vet people, is to talk to other people who've had it done in your community. And, I think almost every state now has a Facebook group called Tongue Tie and Lip Tie Support of whatever state it is. And so that's a really great place for parents to go, because when I first started doing this, there was a preferred providers list that was put out by some group. And at the time that I was interested in getting on that list, they had stopped taking entries. So essentially, in their mind, if you didn't already know what you were doing, you would never know what you were doing. And that was that. And they eventually went away with that because there's people learning about this every single day. And what they were finding is that the people who were on their list sometimes didn't know as much as the people who were learning the current knowledge. So, there is no easy way. There are a lot of groups that have this feel of like, we're all very passionate about tongue tie. And if you've taken this class, or if you're a member of that group, you're probably okay. But still, there's going to be a huge range between I took one class from that group one time and I've taken many classes. So I think at the end of the day, finding the people in your community who can say, I went to this person, I went to that person, this is my result. And then knowing what questions to ask about it, which again, in the document I sent you, I have a list of questions that I recommend people ask to find out if that person kind of knows what they're talking about, or if they just
I'll do
heard.
a screen share for everyone, but I'm going to put this in the follow-up email. So this is just the example, and then we'll email it out, it's really amazing and helpful. So yeah.
So essentially, you have to do your research, and I feel like that's so much in medicine these days. I mean, we used to just go to our doctor, and they would tell us where to go and who to see and what the next steps are. And I feel like more and more people are having to just take it into their own hands and say, I need these 3 kinds of professionals in my life, and now I have to go find the ones that are right for me.
So then, okay, there's 2 follow-up questions to that. One is, can you talk about the difference between clipping and lasering? That's like big in our parent community, and there seems to be a divide between who, they're being referred to, like, oh, I don't want to go to that person because they don't do laser. And I don't understand the difference between the 2 and why one would be better, or if it's case dependent.
So those terms in my area, or in my world at least, have very specific connotations. A snip usually means that, so like in Las Vegas, if someone says they snipped my baby's tongue tie, it means the pediatrician took a pair of scissors and did a very superficial little snip right in the front where they could see some restriction. There's usually no bleeding. It's super minor. There's no aftercare required. The problem with that is that's not a full tongue tie release. And I can go over, the kind of the anatomy of that and why that matters. So I don't know if that's everywhere, but that I say that to have people understand that I know of quite a few people around the world, really, who do a really good job with scissors. So it's not that it's the scissors that are causing the problem, or bad by any means. It's whether the procedure is done as a full release or just as a little snip. I'll take a second to talk about lasers, because that's something that I've learned a ton about in the last couple of years. Dentists tend to be sold a product called a laser that is a diode. And it's, about $5,000, give or take. And it's a laser. If you press on the foot pedal, a beam of light comes out. But a diode laser, the wavelength, if you shoot it at your body, nothing's going to happen. They use that wavelength for, periodontal disease, or some wavelengths they use for laser hair removal. Different wavelengths have different purposes. So in order to turn a diode into a surgical tool, you have to actually black out the tip of the laser. The heat builds up to 1,000 degrees Celsius or more, and then you actually swipe it across the tissue to cut. So you're using a hot knife, but dentists are sold this as a laser because it's using laser technology. And so 90% of people offering laser frenectomies are probably offering what we call hot knife frenectomies, which is no different than the old-fashioned, no major difference than an old-fashioned electrocautery tool, which is simply a hot knife. It just has a fancy name. There are other wavelengths of lasers that actually you shoot the beam of light and it cuts. Those wavelengths interact with water, human tissue, and there's so much less thermal damage. They're only about 100 degrees Celsius. So especially when we're talking about infant frenectomies, they've got these tiny little heads, tiny little mouths, and you want to be as gentle and precise as possible without causing thermal damage. So that topic, again, I'm not disparaging anyone who uses scissors, because you can do a good job with that. And in fact, you can do a good job with a diode, but a better tool is one that's less hot, less, skin touchy.
Yeah, think that's like an amazing clarification. And I know there's a large crew from New York City here. So if anybody wants to put into the chat what they're seeing, I don't know of very many pediatricians that are doing those superficial clips, but I do think that's like the read on some other providers is that it like some are more superficial. So it's just helpful to have that perspective. And then some other questions are coming into the chat. So just as a reminder for people who don't want to be on the recording, if you do have thoughts or questions, put them in the chat and I can read it out, or you can write anything privately to us. Otherwise, if you want to unmute and chat, feel free. The recording will just pick it up. So Dr. Tara, here's Katinka wrote this in, which was my sort of next follow-up question to choosing a provider, which is, can you talk about the timing of the release, which I'm sure is dependent, but, and how Bodywork plays into the prep and integration. And that's like one of the things I was so excited to see in your practice is that you're like in-house working with so many different people to address tongue ties, especially in infants.
Yeah, so every one of my patients gets two 30-minute sessions with my in-house massage therapist. She was trained in neurovascular integration, which is similar to cranial sacral therapy. She knows, a million modalities. It's really about intuition and feeling and knowing what you're looking for. But that when I built my practice, it was important to me that I include Bodywork as part of it. And it's why I didn't make any money for a long time, because I had to pay the support staff, because I wanted to see if my vision of a perfect model would even work. Because when you make that stuff optional, there's always going to be people who don't do it. And it's so important to me that I think, okay, well, at least you get 2 sessions, and I'm going to encourage you to see a pediatric chiropractor, your own massage therapist, like anybody who you feel comfortable with for Bodywork. Bodywork is important. And the reason it's important is because we're not just treating a floating tongue. The tongue is connected to our body, which is connected to our shoulders and chest and stomach and feet. And tongue tie is generally a sign of restriction in general. These tend to be tight babies, tight people. We have to compensate. Those compensations cause more compensations down the line. And so, I can cut this piece of tissue under your tongue, but if you're still, my favorite analogy is if you have a rock in your shoe and you're late, you're going to run to your appointment even with the rock in your shoe. You can still get there. But if you had to do that all day, you never had a chance to take the rock out, by the end of the day, your shoulders would hurt and your hips would hurt because you had to move your body in an abnormal way to function. And so that's what happens over time with abnormal function, is that you're causing this cascade of compensations. So in terms of timing of release, that's the big question, right? And the more I learn and the more experience I have, the better I get at kind of triaging that. I think my biggest secret aha moment, realizing that when a baby won't do a suck assessment, a baby under 3 months about, that's not good. If they will not suck on my finger, that's not normal. Babies up until 2 to 3 months should have that as a reflex to suck. So I won't do a release on a baby that age that won't suck on my finger. Those babies get sent to, oh, my light just turned off. Those babies get sent to infant specialized oral motor specialists, which here in Las Vegas is a couple of speech therapists. I know some occupational therapists know that stuff, some IBCLCs. Other than that, I don't have any like secret hard and fast rules. It's just, I'm sorry, I have one more. Babies over 3 months, I require that they work with a feeding therapist in conjunction, oral motor specialist in conjunction with my release. Because as I'll probably say 100 times, if you don't change the function, you haven't solved a problem. I am not excited about cutting frenums. That's not the part that solves a problem. It's a roadblock. I'm getting rid of that roadblock so that the patient can then learn how to use their tongue properly and get rid of all the symptoms that were caused by that abnormal function. So timing of release, it's getting the baby to their best state that they can be as they are, and not letting it go long till the bad symptoms overpower. And it's different for every single baby.
Can you go through, for people that are unfamiliar, I think for those of us that are doulas or new parents or lactation counselors, like the thing we're looking at is a baby who has trouble latching. That's like the issue, right? But from your experience, and this will sort of go into the next question that Stephanie just wrote, but besides breastfeeding, where else are we going to see the effects of tongue tie or lip tie on babies who become infants, who become adults?
So the big markers: breastfeeding, solid foods, transitioning to solid foods, then speech. Those are, kind of some commonly known effects of tongue ties. The ones that are less commonly known, which really is what kickstarted Smart Mouth, because I'm a dentist, is the fact that the tongue is the driving force between upper jaw development. So that is the precursor to a ton of other issues. Our tongues are always supposed to rest in the roof of our mouth. Tongue tip right behind your 2 front teeth, the rest of your tongue all the way up. If that happens from infancy through birth and development, then your upper jaw knows how wide and how far forward to grow. Then you have room for all your teeth. You have room for your tongue. That means your airway is the right size, because the size of your airway relates to the size of your jaws. If your tongue has enough tone to hang out in the roof of the mouth like it's supposed to, you're less likely to be snoring at night because your tongue's not falling back and blocking your airway. It means you're nasal breathing, because if your tongue is up, you absolutely can't breathe through your mouth. So that part of it is, I think even more important, because that is what affects so many things, but no one's connecting it back to the tongue. When you're told that your kid needs to have braces, you don't think twice. Like, I had braces, my aunt had braces, we're going to make the teeth straight. But why were they crooked in the first place is the question. And it usually comes back to what the tongue did as a child.
Okay, it's so interesting. I don't need to go into my life story, but I had braces and then I had a permanent retainer put on. And after like debilitatingly chronic shoulder pain, as a very young adult, wound up seeing a lot of alternative healthcare practitioners who eventually got me to remove the permanent retainer. And it was, I can't overemphasize how overnight it was. Like, I left the office and I never had a chronic headache. I never had shoulder pain. That was it. It was done in my teeth. The orthodontist said to me, I'll take this retainer off, but it's not going to help your problem. Your back pain is not being caused by this. Like, basically all those other doctors are quacks. And I was like, that's fine. And he was like, in your teeth, basically your teeth might get ugly again. And I was like, I'm already married and I have 2 kids. So like, it's okay. But my teeth have started shifting, but it's been 7 years since I had the retainer removed. And only now am I seeing a change. And as it's happening, I'm thinking like how happy my jaw and my head must be to like have the space to move freely. Right. I don't think very few people would have that perspective, but okay. So here's Stephanie's question, which is connected. For adults that are getting their tongue tie released, because I think more and more people are hearing that. And even if that's helping headaches or neck pain, the tongue tie often comes back, even if they're diligent with tongue exercises. Can you speak to that? But then also, do you see that happening in babies too, where it grows back after release?
So I don't know if I so much believe in it growing back. I absolutely see things get tighter after I've released them. And then as they heal, they're not looking great. And that's a huge part that really ties in with the body work. Okay. So basic wound theory knowledge is that if you have an open wound that's scabbed over and the 2 sides are touching, it's going to heal back together. Okay. Any wound on your body, you have a cut on your arm, you have, 2 open sides of the wound that are healing back together. And that's what we want to happen. In a tongue tie release, we want to avoid normal biological processes because otherwise it will heal right back. So stretches, that's what we call them in the office. It's just the popular term for it. The active wound management is maybe a more formal term for it, but that's necessary to make sure that scab is healing like this underneath the tongue, which is going to give us full range of motion, period. Now, past that, I still get parents who are like, I did this. I texted you a picture every 4 hours of me doing the stretch. Like, I absolutely did all the stretches. Why did it grow back, or why didn't it heal properly? And it's 2 things. It's undiagnosed full body tension or untreated full body tension. That baby is just so tight that everything is working against that relaxation and opening. And so that really happens during the scar tissue phase. So we've kept the scab open, the wound healed open, everything looks great, the scab is gone. Now we have scar tissue, and then the scar tissue just curls up and pulls in and tightens everything together. So that's not growing back. That's just part of the healing process, kind of going, again, the wrong way that we want it to go. The other reason is function. My patients do a 5-second stretch every 4 hours in the first 2 weeks. That adds up to 30 seconds a day of manual stretching. There's still 23 hours, 59 minutes, and 30 seconds of the day where that could be happening. So what is really important is that the baby is learning to use their tongue properly, doing that wave motion. And that's another reason why the function is so important. So the babies who, they met all my markers. I thought they were ready. They looked good to go. We do the release. They're doing their stretches. And suddenly at like week 3, 4, all the symptoms come back. Everything's sorry, I should say it the other way. These babies, they never get better. You're never seeing that improvement. Finally, week 3, they might come in my office and I do a suck assessment and I'm like, oh, cool, they're actually doing that wave motion. How are things going? They're still not going great. It's because it took 2 weeks for baby to figure that out. And in that amount of time, the wound had some reattachment, it had some tightening. And so we lost that window to get that full good healing. So, I mean, in a perfect world, every baby is nice and relaxed and released before, Bodywork, no torticollis, and they're maximizing their function. Then we do the release and everything goes well. But when you see things heal poorly and you know that the parents actually did their part of it, it's usually either chronic body tension or poor function. The function didn't improve quickly enough.
Is there an element of scar tissue massage, or is that just the stretching?
No, so weeks 3 and weeks 4, and plus a lot of times in my practice, it's all about the massaging. First 2 weeks, we're managing the scar. From week 3 to until there's no more scar tissue, it's managing scar tissue.
Yeah.
And it's a long process. And I tell every patient at every consult, this part sucks. It's the worst thing about what I do. Baby will hate it. You will hate it. You have to commit to this, or else there's really no point in doing it my way.
Yeah. Okay, hold on. Nubia, you can unmute and ask your question.
Hi, Ashley. Oh my gosh, I'm so sorry. There's a little bit of work happening and I hope it's not too loud for you to hear me. I'm a birth doula and I support a lot of moms, on the postpartum side of things when babies are very new. And we know that usually we identify the tongue ties because, or we suspect there's a tongue tie because, like Ashley was saying, there's some issues with breastfeeding or latching. And I'm just wondering for babies who may skip the whole breastfeeding part. I haven't had this happen personally, but I'm thinking about that. If they are just bottle fed, is there any way to identify ties, or are there any signs that a family should look out for if the baby is only bottle fed that may, signal, oh, maybe there's a tie here, so that we can prevent, that whole time period of them getting worse and it leading to other problems? Or should we make tongue tie assessments just like routine? Because most pediatricians do not do it regularly.
No. I'm a huge believer in that. People always ask me when should they bring their baby in for an assessment, and I say as soon as possible. That doesn't mean you have to get the procedure done. I don't even do same day procedures. There's no pressure that you come in my office and that's what needs to get done. If as a parent myself, I mean, I wish I had known that my middle child had a tongue tie because I suffered for a year and didn't know why. I absolutely think that tongue tie assessments are really important, because whether the parent or family wants to do anything about it, that's on them, but they need that knowledge. In terms of babies who are only on the bottle, they actually have a lot of the same symptoms: clicking, leaking, gassiness, spitting up, colicky type things. Those all have to do with swallowing air or not having a good seal. The problem is that I'd say most babies who struggle with breastfeeding, who the parents just go to a bottle, do okay. And even if there is a little bit of leaking, they don't even know that that's a problem. They just, I just put a bib here and it leaks a little bit when I hear some clicking. I don't know what that is. It's fine. Baby eats their food. I still also get some babies who struggling breastfeeding, struggling bottle feeding. Parents are like, I don't even know how to feed my child. I do a little bit of everything. Nothing works great. I should just wear a t-shirt for feeding therapists. Like, find your local family feeding therapist. That's the last piece of the puzzle that I need in my practice. Then I would essentially just make them do all the work, and I would just be there to, be the surgery monkey. But if there are any feeding issues, no matter how your child is feeding, breastfeeding, bottle feeding, syringe feeding, cup feeding, solid food feeding, if something isn't normal, which again, I think that's our job, is to teach people what normal is, versus my favorite catchphrase is common is not normal. Just because lots of people are experiencing that doesn't mean that that's the normal way that we're supposed to be. But see a feeding therapist, and again, it comes back to, you can't just, Google feeding therapist, because the chances that that feeding therapist knows about tongue ties, knows about function, knows how to work with infants, you have to find that special person. But there's someone out there, there's some option. My biggest beef with pediatricians is that when parents are explaining these issues, they tend to say that a lot. That's normal. And they don't have to know how to diagnose tongue ties. They don't even have to know about tongue ties. What we have to know is that there is this very accepted modality out there that's covered by most insurances called feeding therapy, and they can help you, make it easier. Quality of life is really important. And that's the part that we're missing in modern medicine, is we just want to kind of brush off and normalize anything that isn't life-threatening. And meanwhile, families are suffering because life is harder than it needs to be.
It's so interesting.
Hopefully that answered your question.
Oh, my chair is so squeaky. I'm so sorry. It feels like there's such an analogy to birth work, just knowing that there are a decent amount of birth doulas on the call too, where you said this phrase, right? I can just be the surgery monkey. And like, in no way do I want to be offensive towards obstetricians, but like, I think a lot of people in the birth profession would say like, oh my God, imagine this society where we had like midwives and doulas as our primary care. And then you had the surgeon when you needed the surgeon, and what that comprehensive model looks like. And having that framework to explain it to our community, I also think is helpful, because if they're coming to me with, my baby has a tongue tie and this person thinks I should get it clipped, it's very easy to explain why that's not the one silver bullet of what the issue is. The tongue tie is an indication that something else is going on and you need a collaborative effort. Okay, so I want other folks to ask questions before we run out of time, but the big one I definitely want to get your read on is, are there more tongue ties now, like hundreds of percentages more than in years past, or are we just diagnosing them, and why, and how do you think about that?
That's a hard question. And there is no answer. There's no answer that I can tell you that is written in a textbook, right? Or
yeah, totally. Just, how do you
basically this is my opinion. Okay, so Aristotle talked about tongue ties 2,000 years ago. There's a tool that I use called a grooved director. It's a stick with a little notch in it, and it's what I use to lift the tongue to isolate the frenum so that I can get a clean cut. That was developed in the 1800s for frenectomies. Like, this is not a brand new idea, even though a lot of people want to make it seem like it is, that I'm doing this to make money, which hasn't happened yet. So, that doesn't make any sense to me. There was even a time where this was the most commonly done procedure by, like, in hospitals with newborn babies. It was kind of like they do the circumcision and they do the tongue tie at once. I have a couple of thoughts. One is modern medicine. About 100 or so years ago, a little bit more, they came out with, or they made widespread available to parents bottles and formula. Okay. That made it really easy to say, I'm struggling. There's another option. And when you look back at how formula was marketed back then, it was actually marketed as better than breast milk. Like this is what you need to feed your baby. And so it really kicked off this idea of like breastfeeding isn't the only way, it's not necessary, which is fine. I mean, I'm not debating like what's better, bottles or breastfeeding, but the fact of the matter is that there are consequences to that. And so less people started talking about breastfeeding. The other thing that happened is we went away from midwives to hospital births with OBGYNs, who their main goal is to make sure that the mom and baby are alive at the end of the process. And if that's the case, then they've done their job and then they leave. And then there's a pediatrician who's going to make sure that the baby stays alive. But we've lost kind of that community, hands-on, the midwife who is going to watch baby latch on and make sure that that part is going well, because that is biologically the next part for survival, is making sure baby can eat. I mean, there's tons of anecdotes of midwives keeping a sharp pinky nail and doing tongue tie releases right there, because there was a time when they weren't allowed to use tools, that only physicians could use instruments for surgery. And so they got away with that by using a sharp pinky nail. Basically, everything has become so separate that there's no continuity of care. So I don't, it's impossible to say, are there more now than there were then? Because what happened is we just went through 100 years where nobody paid attention.
Yeah.
Nobody talked about it. Nobody's learning it in school. It's almost like a lost knowledge. And so now people are, again, like kind of taking back medicine and saying, something's not right, and I'm going to keep asking questions until someone can help me, because I want to breastfeed my baby. I have these goals and I'm going to meet these goals. Like, people are empowered to advocate for themselves. So, that's where a lot of it's coming from, is patient driven. I want this. Now, there's also some theories about essentially nutrition, that over the last 400 years, the human diet has declined from what it should be. Processed foods, soft foods, we're not chewing our foods anymore. The tongue is a huge factor in jaw development, but chewing is the other big factor, not to mention the nutrients that you get from those whole foods. And so we've seen a decline in jaw size in the skull record over the last 400 years. Things are absolutely changing. So what other issues are being caused by this decline in nutrition? Not to mention, when neural tube defects were crazy everywhere and they started adding synthetic vitamins to all the cereals and the breads, what impact does that have on a human body? People talk about MTHFR genetic mutations and demethylation, and we don't know how all those things are impacting the human body. But if you look around, humans are not healthy. There's chronic disease. Everybody's, got something. And it's not a far stretch, in my opinion, to think that a tongue tie is one of those consequences, that it is now something that is common in humans, that we just assume is normal because we don't know anymore what normal actually is.
Yeah. there's so many analogous points there to the birth and postpartum period at large. I'm reflecting on all of them. Nubi, I'm going to give you a chance to ask your question while I process. Yeah, Nubia, do you want to go again?
Sorry about that. Great. I was just about to ask a question about how nutrition plays a role in ties, and you did answer most of it. I just wanted to be more specific. Do you know if it's related to iron? Because I have heard, I am also a integrative health coach through IIN, and so we did some studies, and just like you were saying, the synthetic vitamins and the poor nutrition that we're getting through the foods that most people are eating regularly don't have the whole food nutrients or vitamins, minerals in them. And my understanding was that iron, very specifically iron, is a problem for tongue ties and it can increase the chances. Is that true? Well,
I haven't heard that. I don't know. Yeah.
okay.
And the one thing I like to say to moms is that it's not their fault. I get people, if I had taken a different supplement, would my baby not be tongue-tied? We're talking generations here. You blame your great grandma for, eating oatmeal instead of, I don't know, like it's a long process, and I've seen it all. I mean, we get those little case studies occasionally where you get that, that mom who is just perfect. They eat everything right and they get their blood checked and all their levels are good, and that's something that's so important to them. And then their baby comes out with like a to the tip tongue tie, and it doesn't make any sense because it's not, unfortunately, black and white like that.
How often are you seeing babies who are tongue tied and then you diagnose the parents like they have all the time?
I mean, it's much less now that we have to wear masks.
Yeah.
It's actually really interesting. I used to kind of bring in what I would notice about parents to the conversation to kind of, use analogies and help them understand. And now I have no idea what their teeth look like, and no idea what they're doing with their mouth when they're talking. And so it definitely, now I don't get to be that person. Now I just have to wait for them to like say something about themselves, and then I go, let me see. They take down their mask and go, oh yeah, you definitely have a tongue tie. Like,
because from like a pediatric OT or PT perspective too, I know that a lot of people talk about posture, ways that kids sit or stand, like all of that tends to mimic parents really early on also.
Yeah, I think that comes back to the whole bodywork perspective, that we're just, the compensations cause these cascades that sometimes we don't even recognize how it got there. But I've had so many outlier results that I would never say, oh, if I do a tongue tie release, this and this are going to happen. But I've had, 11-month-olds who weren't crawl the day after a release. I've had, kids who walk pigeon-toed, stop watching. It's like you see all these random outliers, and there's no doubt that there's a connection there. It's just, how are we going to figure out what that connection is? It's an impossible task.
Yeah, I feel like it's just so helpful for me. This is a framework. I am actually noticing that our companies have very similar names too. It's, that
Yeah,
critical thinking and intelligence piece, I think, is really important, which I appreciate. And so it fits really well for how we're going to talk to parents about making decisions and taking a broad perspective. I think that what I would want to flesh out, I'm thinking of like one family in particular, and we do get this question a fair amount. Maybe this is a way for us to wrap up. The idea that okay, let's say breastfeeding is the sign where we're like, okay, we think that there might be a tongue tie. We're not totally sure, but something here isn't working. Would the order of operations for how to address that be body work, release, body work? Or is there ever an indication where you would go right to a release before the body work? Like somebody called me, I forget, I don't know if she's on the call or not yesterday, and we were talking about this in preparation. And she was training to become a craniosacral therapist and said there are so many craniosacral therapists who think body work alone can fix a tongue tie and you don't need the release. So is that something you start with? And then if that doesn't work?
I think it all comes down to the family. You have to, meet the family where they're at. I definitely get people who somehow find their way into my office and they're very resistant to anything I say to them. They don't want me to do this thing to their baby. They don't think there's a problem. That's the beauty of body work and feeding therapy. You can do that with, there we go again. You can do that with no negative effect, to the body. We're not causing harm by doing those things. I think body work is always important. I think I like to imagine that when we lived in, communities and that the midwife was, or the midwife's assistant, or there was some person in that process who did body work. I think body work is probably one of the missing pieces to humans, the way we develop. We don't have hands on each other in that healing way. And, and then, so if it isn't helpful, again, you didn't do harm, right? So that's the beauty of it. I am perfectly willing to admit that I call it a class 4 tongue tie. We call it a posterior tongue tie. There's a lot of really bad names for what that type of tongue tie is. But the deep type of tongue tie, where you don't actually see a frenum pop out, you're having the same laundry list of issues, I think it's tight, right? And surgery is one way to fix that tightness. If you have the time, energy, and money to go to a body worker, do the therapy, do the work, that's going to require a lot of manual work. Often you have to get rid of the compensations. It's a whole thing, right? That would be amazing. And I would love to see those cases. It's just not practical a lot of the times. But I don't doubt that that's possible in certain situations. And I think that's, someday, maybe, hopefully, we'll find a way to differentiate between like a true posterior tongue tie and a fascial restriction that looks like a posterior tongue tie, that can be treated with body work, and this one can't. Again, it's like experience and triaging and listening to what the parents' goals are, like that, just those things have to dictate the plan that you take.
Wait, I can't hear you. We lost your sound for a second.
No, is it back now?
Now you're back. Okay. I don't know what happened. Yeah, I think that makes sense. It's like a helpful way to think about it. My mind is
no one knows all the answers. Yeah. And you can't be a good provider of care to another person if you can't know your limitations and say, this is the height of my knowledge. I can help you find someone who can take it from there, or collaborate with us and help you reach your goal.
Yeah. Wow. this was exactly what I had in mind and wanted to cover. So I'm feeling incredibly satisfied. And there are some other comments coming in there. People are like very happy with the information that they got. To my knowledge, I've never had this opportunity before to be a participant and just actually get to talk it through. It's always like a 5-minute conversation with an IBCLC to be like, well, what do you think? I don't know. Okay. So it's helpful to sit with for a little bit. Does anybody have another question before we go? And otherwise, I'll be sure to share Dr. Tara's contact information, and I'm obviously always accessible if you need me. And we'll share that handout too. Nubia, yeah.
I'm sorry. I love this. Thank you so much.
You're welcome.
You're great. And I want to know if you offer virtual sessions. I know that you can't do releases virtually, right? And your whole team can't help virtually, but I wanted to know if you offer initial consultations for families who just want to start with someone who's knowledgeable, like I think that would be amazing.
So what you're saying is I should add this service to my, okay, I'll add that to my list of things to do after I raise my 3 children and, keep my business afloat. So no, I'm not set up for that, but I think I'm here in my own little world. I have literally built my knowledge from scratch and built my practice from scratch. And at the time I was creating it, there really wasn't anything for me to look at and copy. And now, there's a handful of practices like mine, and we all do it differently. And so it's hard to know when you're on the right track. So I appreciate that. And I'll keep that in mind that, I started this because there was no one in Vegas who knew this stuff, and I wanted to be that person. And I always feel bad. I hear a lot of stories about I had to drive 4 hours to get the release. And I'm, selfishly grateful that I don't have to do that. Vegas is kind of this very isolated thing. Because I want to do my 2-day and my 1 week and my 4-week follow-up. And I want to include the Bodywork, and I want to, do all those things. And that's not really doable if you live 4 hours away, but I will think about that. Thank you.
I also just think it's about what I was saying earlier, that it's about the tongue-tight information coming out into popular discourse a little bit more, so it doesn't feel like this very like esoteric thing that you don't really understand, but you have to go pay a specialist. Like, I think if we just start spreading more knowledge about what comprehensive care looks like and what the team looks like and how you make these decisions, in the same way that's happening with breastfeeding in general, right? Like, you don't just start to breastfeed. Now there's all these people involved and there's things to think about. Not only will there be professionals who take it on, but parents will feel less intimidated by it. And then, doulas and lactation counselors can all just provide some more guidance, not diagnosis, but just help people think this through. Because it's hard to be 1 week postpartum and have to learn.
And I blame the Facebook groups a lot, because any symptom you have, it's normal. I went through that. My neighbor went through that. My grandma and me and my baby, we all had the same thing.
And we're all fine.
We're all fine. It's normal. And I want to empower that if something doesn't feel right, that's not right for you. Like that is a problem. And it doesn't matter what anybody else thinks about that. And then, knowing where to go from there, because I use Facebook for the same reason. I need support. I need camaraderie. I need to, vent to people who don't know me. But at the same time, they're not the specialist for whatever problem I'm having. And finding that specialist is that's the hard part.
Yeah. Okay, I want to be respectful of everybody's time. So let's call it. And everybody stay in touch with both of us as you need us. Thank you so much for being here.
It was my pleasure. It was fun.
This was amazing. Thank you, everybody. Have a great rest of your week.
Thank you.
Bye.
Thank you. Bye.
Bye.